Distinguished guests, ladies and gentlemen, good morning and good afternoon. Welcome to join us at the Exploring the Middle East Healthcare Opportunity webinar. I am James, your MC for today. This webinar is organized by Taiwan External Trade Development Council and our overseas branch office in Dubai and Riyadh. Today, we have an incredible lineup of experts from Saudi Arabia and United Arab Emirates. They will share their experience and potential business opportunities in the Middle East healthcare industry, mainly on the market trends and regulations. After that, we will have a Q&A session for 20 minutes before we wrap up today's webinar. To kick off today's program, we would like to invite the President and CEO of Taiwan External Trade Development Council, Ms. Lenore Lin, to give us the opening remark. Please welcome President Lin.
Ladies and gentlemen, good morning, good afternoon to all our dear friends watching online. On behalf of Taiwan External Trade Development Council, TAITRA, I'm pleased to join this webinar, focusing on Saudi Arabia and the United Arab Emirates healthcare markets. Healthcare is one of the fastest growing industries in the Middle East and North Africa region. A report by Fitch Solutions shows that the region's healthcare market is projected to grow from $185.5 US in 2019 to $243.6 billion US in 2023. And the Kingdom of Saudi Arabia and the United Arab Emirates remain the most attractive healthcare markets in this region. Taiwan is renowned for its high-quality standards of medical care. Over the past few years, Taiwan has been actively progressing by incorporating technology into the healthcare industry. On the other hand, Saudi Arabia and the United Arab Emirates are well known for their comprehensive healthcare systems and innovation. Taiwanese business can cooperate with Middle Eastern countries in the areas of not only the healthcare industry, but also medical services, pharmaceuticals, and digital healthcare. At today's webinar, we are honored to have three distinguished speakers from governments and private companies to share with us the potential opportunities of the healthcare industry and offer the experience of engaging in healthcare business in Saudi Arabia and the United Arab Emirates. TAITRA is not only committed to establishing platforms to share our latest ideas and innovations, but also strengthen the relationship between the Middle East and Taiwan. In order to help our businesses deploy overseas and take advantage of the Middle East competitive investment environment, we have organized an online business matchmaking event on September 13th to 14th. I sincerely hope this event will be of benefit to everyone. To conclude, I would like to thank you again for attending today's event. I wish you all the best, good health, and prosperous. Thank you.
Thank you, President Lin. Next, please welcome Representative of Taipei Economic and Cultural Representative Office in the Kingdom of Saudi Arabia, Dr. Tan Sen Ping. Let's welcome Representative Tan.
Distinguished guests, ladies and gentlemen, it is my privilege today to speak some words for this symposium. Taiwan and Saudi Arabia have a very long history of cooperation in the medical field. For instance, At the invitation of the Saudi royal family, Taiwanese medical doctor Zhang Congmin has been served in Riyadh Shumaisi Hospital, which is the King Saud Medical Center now, since the 1960s. Dr. Zhang has served in Saudi Arabia for more than 40 years with his excellent medical skills. In the 1970s, the medical cooperation between Taiwan and Saudi Arabia was further expanded. The Taiwan government once organized the best medical teams in the country and dispatched them to 3 hospitals in Saudi Arabia, including Jeddah King Fahd Hospital and New Jeddah Clinic Hospital and Hafuf Public Hospital. At the time of the largest number, there used to be 1,200 doctors, technicians, and nurses at the same time serving in Saudi Arabia. In recent years, Taiwan has also invited Saudi medical experts to visit Taiwan many times to inspect Taiwan's medical system. A few years ago, Professor Wu Yao Min of National Taiwan University Hospital, who is also the world's most famous expert in robotic liver transplantation, has also visited King Faisal Hospital in Saudi Arabia several times to share the most advanced robotic liver transplantation surgery. Therefore, Taiwan and Saudi Arabia have long been deeply connected in the medical fields, and the Saudi Arabia society and the people are very familiar with Taiwan's high-quality medical skills. In addition to Taiwan's advanced medical technology, Taiwan's high-quality software and hardware equipment is also well-known in the world and has been sold to many countries. Therefore, there are many special and significant meaning for the TITRA to hold Middle East Medical Business Opportunity Symposium today, especially is to further introduce Taiwan's high-quality medical software and hardware equipment to the Saudi market, so that the public in Saudi Arabia will also have the opportunity to enjoy the same level quality as Taiwan's medical service. In this regard, I believe with the efforts of the TITRA, the cooperation and exchange between Taiwan and Saudi Arabia in the medical field will be closer and expanded. In conclusion, I wish today's symposium every success, and thank you so much.
Thank you, Representative Tan. And next, we would like to invite Director General of the Commercial Office of Taipei, Taiwan, Dubai, UAE, Mr. Andrew Yan, to share a few words with us. Please welcome Director General Yan.
Thank you for having me. Today's speaker, distinguished guests, ladies and gentlemen. On behalf of Taiwan Mission in Dubai, UAE, I would like to express my sincere welcome to all of you at today's webinar. The UAE is a leading country in the MENA region. It has a robust and diverse market with a strong healthcare infrastructure. It is forecast that 4 years from now, the healthcare market of UAE will grow at a CAGR of around 10%. In addition, UAE's Vision 2040 has outlined healthcare as a priority sector. The government promised to reinforce its standing as a healthcare hub in the Arab world. Similarly, Taiwan has been using its R&D and manufacturing capability to make itself a key contributor in the global biomedical supply chain. Taiwan has world-renowned healthcare systems and advanced biomedical and healthcare technology. We believe that Taiwan is a natural partner of the UAE. Therefore, we look forward to further strengthen our ties with the UAE, include but not limited to healthcare sector. Today's meeting is timely. We are delighted to have three speakers. They are Nabeel Mishah, CEO of healthcare company, Dr. Hessa Jafar Hassan ElGhamrawy, acting section manager of Dubai Municipality, and Mr. Abdelrahman ElGhamrawy, regulatory affairs executive. They will share with us healthcare business opportunities in the Middle East. I believe you may find useful information from their experience and observation. Without further ado, I wish the event every success. Good health to all of you, and God bless you. Thank you.
Thank you, Director Yan. Allow me to welcome both directors from Taiwan Trade Center in Riyadh and Dubai to give a brief introduction about their respective countries. First, we go to Director Udi Wang from Riyadh.
Distinguished guests from Taiwan, Honorable Ambassador Deng and Yang, and our Thai tribe colleague, good afternoon. This is Udi Wang from Taiwan Trade Center, Riyadh. Today is my great pleasure to have the chance to attend this online event, and we are happy to invite the professional expert in this field of the Middle East. Especially there's Dr. Nabeel from Saudi. He's professional in medical and healthcare field for a long time. So we definitely assume that after you have listening his good experience sharing of this market, you can have a better idea and how to explore this market in the near future. And besides this, I want to introduce also Taiwan Trade Center Riyadh office. We're opening officially soon in the next few weeks. So we are happy to serve all our Taiwan company in the near future, and also welcome you will pay a visit in the next half of the year, either through our delegation or any kind of visit. We are most welcome, and due to the COVID-19 situation here is getting better and better. Now even outdoor is not necessary to wear the mask, and to enter Saudi even so far no need to do a PCR test, free to travel. So we are happy to see you here soon, and hope you enjoy today's event and experience sharing. Thank you.
Thank you, Director Wang. We are very happy and looking forward to see you soon. Next, let's check in with Director Fu Taiwei in Dubai.
Hello, ladies and gentlemen from Taiwan. This is Wei Fu Tai from Taiwan Trade Center, Dubai. The UAE, 阿联大公国, is a wealthy oil exporter in the Middle East, with a GDP of around $40,000 per capita. The population in UAE keeps rising to around 9.85 million in 2021. The number of elderly, children, and the foreigners has also continued to rise. The national income of the Gulf countries is relatively high, and the people's living standard have generally improved, resulting in an increasing incidence of three high symptoms, 三高, such as hypertension, hyperlipidemia, and hyperglycemia in this region. Therefore, there is a strong demand for hospitals in the Gulf countries to upgrade or purchase additional medical equipment and diagnostic instruments. Rapid population growth and high spending on health care have become the major driving forces behind the market's development. Its huge market potential and the rapid development market make it very attractive to medical equipment and pharmaceutical product suppliers. Governments in the Middle East region pay close attention to the construction of the local medical and health sector, in addition to continuously adjusting relevant policies and regulations. They also plan to implement large-scale medical construction projects to meet the fast-growing medical needs. Finally, about the COVID-19 conditions in UAE. Currently, UAE has around 300 COVID-positive cases per day. International visitors flying to Dubai who are fully vaccinated will only need to present a COVID vaccination certificate that contains a QR code. As for unvaccinated travelers, will need to present a negative result for a PCR test taken within 48 hours, and no quarantine needed after arrival. As for the face mask, have been made optional in outside areas. However, masks are still required to be worn in all public indoor places, shopping malls, and schools. Most social activities like exhibitions and conferences are back to normal. Thank you.
Thank you, Director Wei, and thank you both for providing valuable information. Now, let's move on to the presentation. During these sessions, you are welcome to submit your questions in the chat room and mention to whom your question is addressed. So we'll be collecting those questions and invite the speakers to answer them during our Q&A session at the end. The first speaker is Dr. Nabeel, CEO from Health Diamond. His topic today is Overview of Healthcare Industry in Kingdom of Saudi Arabia. Please join me in welcoming Dr. Nabeel.
Good day, everyone. Thank you very much for giving me this opportunity, and I would like to thank Taiwan External Trade Development Council, TAITRA, and in this presentation, I will give the information about the healthcare business opportunities in Saudi Arabia. I will cover 4 main topics. The first one is the basic information about the Saudi Arabia, and then I will talk about the healthcare market in Saudi Arabia, and then the opportunities in Saudi healthcare, and then I will cover the Saudi Arabia as healthcare hub. Information about the Saudi healthcare market. The area of Saudi Arabia as a country is 2.15 million kilometers square, and the population is about 35 million. The number of hospitals around 450. Primary healthcare centers, we have around 2,500 primary healthcare centers. The location, Saudi Arabia is located in Arab Peninsula, in the middle of GCC countries, Africa, North Africa, India, and Europe. Legislation, governmental encouragement for this market. Also, the government is promoting privatization, and also they are promoting the development of healthcare insurance, and this is emerging business as well. And then for financial support for this market, the Saudi Industry Fund, and there is a Saudi Export Bank as well, and new hospital support. The government supports establishment of new hospitals across the kingdom. healthcare sector attractive to investors is the rapid population growth. In 2022, we are 35 millions, 22 million citizens, and 13 million expats. And it is expected by 2042, we will reach 50 million inhabitants. So the healthcare market size is rapidly growing, maybe by 3 to 4%. For healthcare industry, age groups and gender is very important to plan ahead and put the investment in. As you can see here, that the Saudi population is very young right now, and main population coming from the age of 28 or maybe 30 up to the 50. And as you can see, the males are much more than females, and this is because of the expats. They are mainly male, and I think this is going to shift after 10 to 15 years. So the population will shift upward, and most of the population will become in the 60, 50, 70 age groups. And as you know, after 50, this group of population needs more healthcare services and healthcare tools and consumable items, drugs. So this is why it is very important to start the business in Saudi Arabia in healthcare sector. So because you are planning actually for the next 10, 15 years. Thank you. Another factor which makes Saudi healthcare sector attractive to investors is that the Kingdom of Saudi Arabia is in the heart of the Arabic and Islamic world, and near to Europe as well, Africa and other continents. So many people coming to Saudi Arabia to perform Hajj or to do Umrah, that is visiting to the two holy mosques located in Saudi Arabia. So in year 2017, we reached 9 million tourists, and in 2019, that is increased by 15 million to reach 15 million. As you know, due to COVID-19 and pandemic lockdown in year 2020 and 21, no visitors or pilgrims coming to Saudi Arabia due to the lockdown. And now we are resuming resuming the tourism activities, and we are planning to reach 40 million visitors by 2030. And actually, the government now, health insurance became mandatory to all visitors and tourists. Care providers currently in Saudi health market sector, MOH still is the main player, and it is operating around 400 hospitals. Other governmental sectors like Ministry of Defense and Aviation, that is MUDA, known as MUDA, and then the National Guard and Security Forces Hospital, SFH, and Ministry of Education, that is mainly university hospitals, and other companies, semi-governmental sectors like Aramco. They are all providing healthcare services, either by hospitals or polyclinics or healthcare centers. The private sector now, it is just growing, and I think in the next 10 years or 15 years, the pyramid will be upside down. So the government is promoting privatization and promoting the private sector to be the major player in healthcare industry, and most of the healthcare services in the future will be executed by the private sector. If we can imagine the Saudi healthcare industry as a pizza, so we can cut the segments into 7 main segments: healthcare providing and pharmaceutical and drug industry, and then the third slice or segment is the healthcare equipment manufacturing, and then IT and support services, healthcare IT and smart applications. The other one is these tools and consumable items. Also, the healthcare education and training is important. Also, healthcare research and development activity, it is very important. These 7 segments is very attractive to all investors coming to invest in Saudi healthcare. As you can see here, that the location of Saudi Arabia is very, very strategic, and this is why the Saudi government is planning to make Saudi Arabia as advanced healthcare hub in the region here to attract not only local patients, but to attract the regional patients and international patients, since the geographical location of Saudi Arabia is very attractive, and the health organizations and hospitals, they are among the top organization in the region, and this is why we are targeting actually the patient from all other countries. Healthcare business opportunities, it's coming under 8 categories in Saudi Arabia here. The first one is hospitals, clinics, and polyclinics. And the second one is the specialized centers, especially there is a need for cardiology centers, neurosurgery, plastic surgery, infertility, cosmetic centers, laser centers. This is all needed here in Saudi Arabia. Also, the equipment manufacturing is very attractive. As you know that the equipment manufacturing like radiology equipment, X-ray, CT, ultrasound, MRI, and also laboratory equipment and rehabilitation equipment. For the tools and consumable items manufacturing, this is a huge, huge market as well, including the single-use items like catheters, guide wires, needles, swabs, and gauzes and cottons. This is all needed, and surgical tools as well. Pharmaceutical items, it is very much demanding here, like the antibiotics and other drugs. For the diabetes and for hypertension and cardiac problems, renal failure. Also, the IT solutions and smart applications is needed, and investors can come and establish business in this sector. And education and training as well is very important, and there is high demand on education and training. The last one is emerging after the COVID-19 pandemic, that the government now is trying to attract biolabs and investors in this biolabs, and especially in the vaccination programs. So the 8 sectors here, actually, they are a very, very good opportunities to the investors. Those who want to start business in Saudi Arabia and invest in healthcare, actually they can come as a direct investor. Now the government is attracting investors to come and directly invest in the Saudi market. You can also go for branding and co-branding or looking for a local agent. Also, there is another opportunity that you can actually, and this is good for the investors, you can buy equity. So, or you can share establishing local factories, local hospitals, local healthcare provider, local manufacturing. So actually you can have your own direct investment, or you can have only equity sharing, or do branding and co-branding and agency dealer or dealership business. Market entry, actually you need different project, different investment goes to different routes. So this is the main 6 organizations that you might deal with. So the first one is the commercial record, that is the Ministry of Trade. You can establish your company and issue your CR. And then if you want to invest and produce your drug or tools or items, or you want to export it to Saudi Arabia, so you really need to have the certification from the Saudi FDA. And also you might need the Saudi SASU, that is Saudi Safety and Operation Certificate. And then also you might need the certification from or licensing from Ministry of Health and Ministry of Industry and Minerals. And also there are a couple of governmental agencies that you might need to get the license from. But this is actually based on your type of investment. Healthcare market penetration proposal. This is actually coming from my long experience. I am in the market for the last 27 years. And I know that it is very difficult to enter or penetrate the Saudi market, since there are a lot of companies already operating in Saudi Arabia, or exporting to Saudi Arabia, or they have a partner here in Saudi, and they are partially manufacturing or exporting the items. So my proposal is that the Taiwanese equipment and pharmaceutical companies and consumable and tools manufacturers and educational training, IT, and other support services, they can all join together to establish a chain of hospitals and medical centers across the Kingdom of Saudi Arabia. And then these hospitals and medical centers can buy or purchase the Taiwanese products and services. So we are creating the client, and we provide and supply the items and the services. So this is the easiest way to penetrate the market. Otherwise, the selling cycle is very long, and you have a lot of competitors, and very strong competitors, especially the European competitors and the American competitors. So, and the people coming also from China are very, very strong. So I think I can provide this winning business model that all the Taiwanese investors can join together and establish hospitals, chain of hospitals and medical centers, so they can buy and consume the products and services from Taiwan. Thank you very much for giving me this opportunity, and thank you for listening. And I am welcoming any one of you to contact me either by WhatsApp or email. I prefer WhatsApp because it is much convenient for me. I really don't check the email regularly. So WhatsApp is the best communication tool, and it is the most available tool in my hand. Thank you very much again, and I'm ready to receive any questions, if I may, and thank you very much.
Thank you very much for sharing such a comprehensive presentation. Thank you, Dr. Nabeel. As a reminder, you can leave your questions in the chat, and Dr. Nabeel will answer them during our Q&A section. Now, for the next speaker, we would like to invite Dr. Hessa. She is the Acting Manager for Health and Safety Department, Dubai Municipality. She will be introducing to us the consumer product safety regulations in Dubai. Please welcome Dr. Hessa.
Good afternoon, everyone, and thank you for attending today's webinar about the consumer product safety and regulations in the Emirate of Dubai. To introduce myself, this is Dr. Hessa ElGhamrawy, the Acting Manager of the Registration and Permit Section in Health and Safety Department in Dubai Municipality. Before I start my presentation, I'd like to thank the Taiwan External Trade Development Council for this invitation and allowing us to participate and to enhance the collaboration between the Taiwanese companies and the Middle East market to increase the business opportunities in the Middle East market and to provide a clear guidance about the consumer product trade and safety between the both markets. To start with, we'll give you an overview introduction about the role of Health and Safety Department in Dubai Municipality. As you see here from the presentation screen that our scope is a very big scope, including many areas about the health and safety control in the Emirate of Dubai in the UAE. We control all consumer products from the ports till it reaches the consumer. We have a major role to maintain environmental health. We ensure as well the occupational health and safety for the workers of more than 2 million workers in Emirate of Dubai. And also we ensure the public health and safety of more than 3 million people in the Emirate of Dubai. We'll focus today, inshallah, about the consumer product. We are speaking about that we control the safety of more than 7,000 retail shop dealing and redealing with the consumer products. To elaborate more about the role of Health and Safety Department, and you see here the summary of the statistic for the premises that we are controlling. We have more than 4,000 salons and barber. We are regulating as well the smoking areas. We regulate the shopping center and to maintain health and safety and environmental health as well in these premises. We have access and control to over 100 open areas like the parks, beaches, etc. We as well control the fitness centers, gyms, hotels, laundries, school, residential buildings, massage and spa, industrial establishments, play area and cinemas, and labor accommodation. So we can say that where is needed health and safety, we are there to check the compliance, the high level, and to ensure that these premises establishments meets the higher standards of safety, of health and safety in the Emirate of Dubai. So moving to the scope of consumer products trading, as you know, maybe, and to elaborate more today, that Dubai is a hub. Dubai is a hub in the Middle East for the trading of consumer products. More than 4.37 million expected to use as a vulnerable group to use the consumer product in the Dubai by 2025. The finance as business reach the value of sales in consumer reach 14.7 billion in dirhams as the trade. In our database, we have more than 320 products registered in Dubai Municipality. We control more than 8,000 retail shops in the local market, and we can say that more than 90% of the product are imported from around 182 countries all over the world. And we are expecting by 2025 that we reach more than even 3 million tons of consumer product through Dubai ports. So here are the summary about the control programs that are held by Dubai Municipality Health and Safety Department. To start with, the Health and Safety Department starts in 2008 with an integrated work programs to ensure the health and safety of these consumer products in the markets, that covering the main categories of consumer products. So we have the main program. It is the registration products in the system, which is very well known now as Montagy. In this program, we ensure the compliance of these consumer products with the recommended standards, UAE standards and Dubai Municipality standards and regulation. After the product registration, we ensure that all the products that are traded in the local market, in the shops, in the salons, in the spas, or in the stores, meet certain standards and product safety standards. We as well control the ports, the Dubai ports. We are located in Jebel Ali for the sea shipments, and we are located in the cargo village, in the airport for the sea shipments, and we are located as well in Hatta gate for the land shipments. During these programs, during the port and market inspection, we conduct a market surveillance and routine inspection in which we withdraw some samples for testing to ensure that the product is really safe to be used by the consumers when it will reach the consumers. During for the market inspections, we are using an advanced system. It's called Smart Inspection, in which even it will grade the premises as per their compliance level in the Emirate of Dubai. Before moving to the procedures and the detailed technical requirements of the registration and product importation procedures, we'll give you a summary about the statistics of these consumer products. We are inspecting of more than 50,000 shipments yearly through all the kinds of ports and in the Emirate of Dubai. Yearly, 2 million or around more than now 2 million tons imported. And for re-export as well as Dubai is a hub, we issue for yearly about more than 8,000 health certificates for different kind of destinations, different countries. And we conduct market surveillance in which we collect more than 30,000 samples yearly from the shipments and from the local market as well. So all this Dubai is a hub, and the need of a fast registration and a fast procedures and a fast approval and fast control. We need a very full developed and enhanced software and system, which is called Montagy. Montagy is developed in 2017 as a new interface and advanced and integrated system for the consumer product safety. It was awarded as a best government initiative in 2017 and awarded as by His Highness Sheikh Hamdan bin Mohammed, and won the flag of His Highness Sheikh Hamdan as the best government initiative. Montagy basically is a software that provides many services for the consumer products, including product registration as a first step, then product importation. We also offer from this platform other services like the free sale certificate. If the country, for example, if the product, for example, is already registered in the Emirate of Dubai and the company would like to export it, yes, we can support this business and provide this certificate that ensure that the product is freely sold in the Emirate of Dubai and it's safe to be by the consumer. And the added value of this initiative, the Montagy, it provides an open data for all authorities, for all investors, for all consumers, either in the Emirate, in the UAE, or even abroad, to check on a spot the compliance and the conformity of the products by just searching by the barcode or product name. They can immediately check the status whether it's registered and can be used by consumers or not. So Who can import the items, the consumer product for trading, and how they can start the trading in the Emirate of Dubai. To start with, any company would like to import a product. First of all, they need to establish a company and get an official license from any authority in the Emirate of Dubai, or even we open to other Emirates. So they should have a trade license by these authorities, and to ensure that the license has a related activity like consumer trading, cosmetics trading, or detergent trading as per the product category. Or general trading, we accept. Pharmacy, we accept. Drugstore as well, we accept. So after they have an official license, they can create a request in the system and register their company in our system. After that, they will be eligible to register their product and then to import this product. There are some main and important business rules in our system in which the company who registered the product in the system, they should import it, or there is an option that another company can be officially delegated by the system as well, and like sister companies, or there is an agreement between two companies, then yes, the system will allow them also by the official delegation to import on behalf of that company. So to focus more on the product registration and listing approval before importation, the company should submit a clear product artwork that show all the main elements of the product labels. We will request as well a free sale certificate. This free sale certificate should include that the product is freely sold in the country of origin, which is an additional measure to ensure that the product is really safe for the consumer and can be used by our consumers. We will request as well ingredient report, which is a very important document that should contain all the ingredients and their scientific names along with their concentration. As everyone knows, there are some ingredients that are banned, there are some ingredients that are restricted, so we need to have the full profile or dossier or the ingredient report to check the safety of the product. During product assessment, as per the risk assessment engines that are embedded in our system, the system will choose as per history, as per many risk factors, will choose if the product require a lab testing or not, and if required, the company should perform and conduct that test either locally in our labs, in Dubai Municipality lab, or they can get it from any other accredited lab all over the world. The fees for the registration is 10 dirham only per application and per variant. When we call variant, it means like if the product has other sizes, these called variants. If the product, for example, comes in different colors, in different shades, like a makeup, then yes, additionally, they can register it in one application with additional 10 dirham per variant. After the product being registered, if the company would like to extract the registration certificate, which is optional, it's not mandatory, no one will ask for it in the ports, then they can extract that certificate, and to pay 200 per certificate. After the product being registered and approved in Montagy system, the company now can import the product freely anytime during the first 5 years, because the validity of the registration is for 5 years. So during importation, we'll request that the product should be registered in our system. Otherwise, it will not be normally released, and it will be released with detention to the company warehouse till they fulfill all the requirements and finalize the registration. In addition, we will request other custom documents like the bill of entry or custom declaration. We'll request the airway bill of lading as per the port type, and we'll request invoice and packing list. Other certificates may be requested as per the product type, as we are regulating the toys, food contact materials. Some kind of products maybe will require more safety documents or additional safety test. During the importation, also the officer in Dubai Municipality, as per the risk engine, will choose some product for the lab testing. If the product match and comply and pass the lab testing, the consignment will be released. If the product is failed, then the consignment need to be re-exported within certain period of time. The export, or I mean the fees of the importation and the fees of the service is 50 dirham per container. And if there is multiple container, they need to pay 50 per each container. Recently also we added a new service as per our customers' needs, which is a health certificate for export. In certain cases that the companies would like to export the product to other destinations, and we have a service called Product Health Certificate. We will request a bill, consumer product purchase invoice. We will request a valid and recent laboratory test to ensure that, yes, the product in this consignment is really safe to be used in the other country. The fees is, for this export certificate is 200, and for the other countries, but for the GCC will be 100 only per certificate. So, general requirement about the lab test, I already explained, but we'll repeat also now. The lab, the report can be conducted in Dubai Central Lab. For example, during the registration, if the Dubai municipality requests a certain lab test during the registration, the company can get it from the Dubai Central Laboratory in Dubai municipality or any accredited lab all over the UAE or all over the world. The lab should be accredited. If it's conducted in a local lab in the UAE, they can check the accreditation of the lab and the test in the Emirates International Accreditation Center. It's called IAC. If it's conducted from any abroad, any outside lab in the other countries, they can check the accreditation in the ILAC website. Along with what we explained just now about the control programs, we have also a product recall in case there is a failure or if there is some unsafe products or the banned ingredients. Sometimes we found a lot hidden ingredient in the consumer product. So our system is integrated with many authorities, and we start our recall process. The recall process in the Dubai is promptly and efficiently. It can be as the patch, if there is a patch failure, or it can be on the product level as a barcode. And the company, we have many aspects. The company is part of this recall, and they should comply, and they should also cooperate in the recall of the products quickly and promptly. We also integrated our systems with the biosecurity early notification system, in which we receive directly all we subscribe our system with this notification system on the federal level in the UAE, in which there is any banned ingredients or any unsafe products, especially the food supplement and food contact materials. We receive directly the alert, and vice versa. If we have any banned ingredients or we found any failed lab test in the food supplement or food contact materials, we immediately alert and inform all the authorities through this biosecurity early notification system, which is belong to the Ministry of Climate Change and Environment. We didn't go deeply to the technical requirements of each category. By the way, we are regulating 6 categories of consumer products. We are regulating cosmetics and perfumes. We are regulating a food supplement, detergent, biocides, all disinfectants, food supplement and fragrances, all the perfumery, food contact materials and toys. All these and requirement and technical specifications and information are already posted in Dubai Municipality portal. You will find detailed technical guidelines per category, and all the procedures are mentioned clearly in the website. We talked before about the open data. If you will download the Dubai Municipality app, it's called Dubai Municipality app. You can find it in Android and in Apple Store, or you can just now also, and we advise you to download it now by scanning these QR codes. you will find a Muntaji window is there. As we said, you can search by the product on a spot, by the product name and the barcode, and get the information and verify about the product safety for you and for your families. So before we conclude our presentation, we'll give you a very quick overview about the leading position of the Muntaji programs and the all kinds of control for the consumer product. Recently, consumer product, the system, the Muntaji, has contributed in the ranking of the UAE and the well-being indicators, resulted as the first rank in the satisfaction with efforts to preserve the environment, because we transform the system to be a paperless system that will help to be an eco-friendly. There is no paper used in the system. And as well, we rank 7th rank in satisfaction with life and satisfaction with standard of living, because it helped the consumer to reach the highest level of safety of consumer products. And we ranked a 6th rank in the feeling that standard of living is getting better and to access to the information in the internet. So we are the first rank in the Arab region and 16th rank globally. In addition to our continuous enhancement journey and efforts, and as per the initiative that is led by and launched by His Highness Sheikh Hamdan bin Mohammed in June 2021, we were required to reduce all our requirements and procedures by 30%. This for sure will maintain Dubai's position among the best cities for doing business, will reduce the cost for doing business, will reduce the cost for you as a traders and that would like to enter the Middle East market, and will help to comply the requirements, because they are easy to comply and they are easy to fulfill. So this will ensure globally competitive procedures and requirements as well, and will achieve the 360 vision of government services, in which we enhance our services and our procedures as per customers' perspective and customers' needs. So what we did, this initiative will help all the traders to support and encourage them to start their businesses in the Emirates of Dubai. We are now at the stage of integrating our Muntaji system with the Dubai trade and Dubai custom system. This will facilitate the free trade between the other countries and will fasten and will make even the process as a paperless, because we will get all the custom information and declarations from the systems and from the source itself. This for sure will reduce the efforts for the companies to enter all the data again, and will increase satisfaction and the customer happiness, because they will immediately get all the information directly and instantly, promptly from the systems. So this is the end of the presentation. The future foresight. In Dubai Municipality, we have many visions for the future visions, in which we can summarize it here, that inshallah we will start even working about the program to control some of the consumer products from the origin. This means we even don't want the shipment to stuck in the custom. We want to give them approval before it reaches our borders. We're also working on developing health and safety legislations to meet and to even get a new required technical informations and technical guidelines for even still not regulated products. We are working on upgrading as well the Muntaji platform to be adopted on the federal level, to help a single one window and one-stop registration that will help to freely trade the products in all over the Emirates and UAE. We are working, as we just said, to integrate our system with other authorities in the UAE, like the Ministry of Industry and Advanced Technology and the Ministry of Health and Prevention in the UAE, and with custom as well for the consignment release. This is the end of the presentation. For any further thank you for listening, and please feel free to have any questions as per today's agenda.
Thank you, Dr. Hessa, for your insightful sharing. And as a reminder, you can leave your questions in the chat, and we'll be collecting them and ask the speaker to answer them during the Q&A section. Thank you. Now, on to our keynote speech number 3. It's our pleasure to have Regulatory Affairs Executive Dr. Abdelrahman to introduce us regulatory overview, placing medicinal products on UAE markets. Let's welcome Dr. Abdelrahman.
Good morning, everybody. Glad to be here with you today and hope to be welcoming some new players in the market soon. My name is Abdelrahman and I will be discussing a regulatory overview about the medicinal products in UAE and a quick walkthrough on placing medicinal products on market. Our agenda today will include general rules and explaining some basic information. Then we will move on for obtaining the required approvals through either classification or registration. First of all, when a company is placed outside UAE, they must appoint a local distributor to act on their behalf. The local distributor should be licensed by MOH as a drugstore. The license should be valid to be able to perform registration, importation, and distribution activities. Relevant departments in MOH which we will be dealing with are the Drug Registration Department, which is responsible for receiving, processing, and issuance of regulatory approvals for medicinal products. Then the Import-Export Department, which is responsible for receiving, processing, and approving import permits. Import permit is a process required for every single shipment of medicinal products shipped to UAE, and approval is mandatory to enable clearance through customs. Approval can be secured if the products are either registered or classified as eligible for direct clearance, or if ordered by government hospitals or institutions. Registration and classification applications can be submitted to Drug Registration Department through their online portal 24/7 in a completely paperless process. Access to this portal is restricted to local distributors with valid drugstore license. Import permit applications are also submitted through an online portal, and same as the registration portal, access is granted only to local distributors with valid drugstore license. Ownership of registration certificates and classification letters is mutually shared by both the manufacturer and the local agent, and the names of both entities will be mentioned on the certificates and classification letters. Registration certificates and classification letters are agent-specific, meaning that a registered product can only be imported by the agent which has his name mentioned on the certificate or the classification letter. Agency transfer of registered products is possible by applying to MOH for endorsement of the transfer, in which submission of a no objection letter from the old agent and an authorization letter from the company to the new agent is required. In case of non-registered products ordered by government hospitals or institutions, the applicant is required to submit LPO or end-user declaration issued by the hospital or the institution, in addition to evidence of product approval in country of origin and relevant quality documents, such as ISO, EC, or manufacturer GMP. Products intended for export only are not accepted. Products must be approved in country of origin to be approved and sold in UAE. Now, for MOH classification, it is a service provided by MOH to inform under which category the product is falling and therefore give guidance about the regulatory pathway we should follow to obtain the approval. The fee for classification is 500 dirhams and the average timeline for processing is 2 weeks. Required documents for classification are a product photo and approval in country of origin, which could be either the CPP, the Free Sale Certificate, the CE Certificate, or the ISO Certificate. The leaflet or the user manual, and for medical devices, product catalog is required, and for pharmaceutical dosage forms, composition certificate must be submitted as well as outer carton and inner label artworks. The possible outcomes of classification can be either that the product is requiring registration as conventional medicine or GSL or herbal or medical device. For professional use medical devices, MOH may grant them direct clearance, except for some categories that MOH insist on getting full registration due to the sensitive nature of these products, such as breast implants and hyaluronic acid pre-filled syringes. Some medical devices may be granted clearance as OTC medical devices, which is mostly happening for Class 1 non-pharmaceutical dosage form devices. Finally, the product may be regarded as out of scope and should be registered with another authority, meaning it is a non-medical product. Classification letters showing direct clearance can be used to obtain import permit approvals, meaning that importation of these products can start immediately after we receive the classification letter. Validity of classification is 3 years, and in case of product families with several variants and sizes or complex systems with several accessories, MOH will accept the whole family or system in a single application. Registration of companies and manufacturing sites is a mandatory requirement in order to be able to submit registration applications for products coming from these sites. The fee for manufacturing site registration is 10,100 dirhams, and the average timeline for processing is 1 month. Company registration can take place along with the manufacturing site in the same application without an extra charge, and if company registration was submitted alone, it will be free. Once a manufacturing site is registered, it will be visible on MOH system for all distributors, and MOH will accept registration applications for products coming from these sites submitted by any distributor. Validity of manufacturing site registration is 5 years. The required documents to register a company and a manufacturing site are an application form to be filled, signed, and stamped by the company. There is Form 1 for company registration and Form 2 for site registration. Application form templates should be already available with any local distributor and can be requested directly from MOH through their inquiries mail. Legalized authorization letter from the company to the local distributor is required. Legalization should be from the UAE embassy in country of origin. Business license is required for company registration and manufacturing license is required for site registration. Valid GMP covering the product lines intended to be submitted is required, and in case of medical devices sites, MOH will require the ISO 13485. Company profile is required for companies and site master file is required for sites. Then finally, a list of products manufactured by the site should be submitted. Now, for registration of medical devices, we must first know that medical devices are classified into 4 classes, where Class 1 will have the lowest risk and Class 4 will have the highest risk. Classification rules are listed in the 2012 guideline, and they are similar to the EU rules. The guideline can be requested directly from MOH through the inquiries mail, and it should already be available with any local district. The difference in the classes will impact registration requirements regarding the level of quality document required to be submitted for the product. The fee for medical device registration is 5,100 dirhams, and the average timeline for processing is 3 months. In case the medical device is a pharmaceutical dosage form, MOH will request analysis at quality control lab, and it may be subjected to pricing. The fee for analysis is 3,500 dirhams, and the average timeline for processing is 2 months if all analysis requirements were readily available and duly submitted once requested. Validity of registration is 5 years. Required documents to register medical devices are: an application form should be filled, signed, and stamped by the company. The application form template should already be available with any local distributor and can be requested directly from MOH through their inquiries mail. Then, a legalized, valid resale certificate issued by the relevant health authority in country of origin is required. Then, evidence of adherence to essential quality, safety, and effectiveness requirements. For Class 1 devices, EC declaration of conformity issued by the manufacturer will be sufficient. For Class 2 devices, MOH will request full quality assurance EC certificate issued by notified body. For Class 3 and 4 devices, MOH will request, in addition to the above, the design examination EC certificate. Then, a general description of the device and detailed description of the device attributes is required. Then, a list of countries where the device is approved and marketed should be submitted. It is always advisable to provide copies of approvals from reference countries to support the application. Reference countries for UAE are EU countries, UK, USA, Australia, and Japan. We also need to provide evidence of established procedures and systems for distribution records, complaints handling, adverse incident reporting, and recall. These can be extracts of relevant company SOPs. Artworks and leaflet or user manual should be submitted, and for lay consumer devices, presence of English and Arabic languages is mandatory. Appointment letter from the company to the local distributor authorizing him to register the product. In case MOH decided that the product is required to go through QC analysis, it is required to submit the following: composition certificate showing active and inactive ingredients with their quantities and functions of the inactive ingredients. and specifications, and finally, methods of analysis. Quality Control Lab will review the documents and will later inform about the analysis requirements required to be submitted by the applicant, such as samples, reagents, reference standards, etc. Then, for registration of Herbal and GSL products, we have mentioned them together in a single topic since their requirements are basically the same. GSL products can be either health supplements, medicated cosmetics, or antiseptics and disinfectants bearing medical claims. The guideline includes the maximum acceptable daily dose for vitamins and minerals in GSL products, which, if exceeded, the product will be regarded as a conventional medicine. This guideline is already available with any local distributor and can be requested directly from MOH through their inquiries mail. The fee for registration is 5,100 dirhams, and average timeline for processing is 6 months, which includes the QC analysis process. In this case, is mandatory. Validity of registration is 5 years. The registration requirements listed below for Herbal and GSL products are: first, a legalized valid CPP or free sale certificate issued by the relevant health authority in country of origin, valid GMP of the manufacturer covering the line of production of the product intended to be registered, list of countries where the device is approved and marketed. It is advisable to provide copies of approvals from reference countries to support the application. Appointment letter from the company to the local distributor authorizing him to register the product, and a detailed composition certificate showing active and inactive ingredient quantities and the functions of the inactive ingredients. Then, summary of product characteristics, and a BSE TSE free certificate. Then, bilingual artworks and leaflets showing both English and Arabic languages. Then, QC lab analysis requirements, which has been explained previously in the medical devices section. For registration of conventional medicine, the requirements are in accordance with the standard technical file ECTD used worldwide, except for Module 1, in which country-specific requirements are included. The average timeline for registration is 8 months, but in case of innovator products, MOH will grant the fast-track facility, which will effectively reduce registration timeline down to 3 months. Quality control lab analysis is mandatory, but unlike other product categories, actual analysis will take place after registration process is finalized by obtaining samples from the first consignment arriving to UAE. All conventional medicines will be subjected to pricing. Proof of stability at Zone 4 should be submitted, where MOH will request accelerated and long-term stability studies. MOH fee for registration is 7,000 dirhams to be paid along with the initial submission, plus 3,500 dirhams for analysis, then 1,000 dirhams for PV plan evaluation, and finally a 500 dirhams fee for pricing. Validity of registration is 5 years. Steps of registration of conventional medicines are: first, we need to submit Module 1 requirements through MOH portal. Then we need to send full 5 modules in ECTD format to MOH, which must be validated first by their side to allow us to proceed. Then PV plan evaluation step, for which submission of PV system risk management plan and the QPPV credentials is required. Then we have to wait until we receive the stability and bioequivalence approvals, which is an internal process handled directly by MOH reviewers, and no additional action is required from our side. Then we should pay the QC analysis fee, even though the actual analysis will take place later. Once the above is finalized, we can go to the final artwork and leaflet review. Finally, the price approval letter will be issued after the higher committee approval, after which we can expect to receive the registration certificate. We have listed below the main requirements for Module 1, which include a covering letter and an application form to be filled, signed, and stamped by the company. Then bilingual artworks and leaflets showing English and Arabic languages, and pharmacovigilance system and risk management plans. Then a legalized valid certificate of pharmaceutical product, CPP. Then valid GMP certificates for the manufacturing sites. Then certificates of analysis of drug substance and finished products, for which at least 3 batches of each is required. Then an alcohol content declaration, a pork-free declaration, and TSE BSC free declaration are required. Then a copy of valid GMP certificate for the API source. Then a recent API acknowledgement letter. In case of different parties involved in manufacturing or marketing, relationship letters or technical agreements should be submitted. Then an appointment letter from the for the local applicant issued by the company or the market authorization holder in country of origin. Then a composition certificate with active ingredients and inactive ingredients quantities and functions of inactive ingredients. If applicable, a patent reference should be submitted. Then registration and marketing status in other countries should be submitted, along with copies of registration certificates from reference countries. Finally, a legalized price certificate is required, which is showing prices in country of origin and other reference countries. The price certificate template should already be available with any local distributor and can be requested directly from MOH through their inquiries mail. Hope this information was enough to shed some light on the regulatory environment in UAE, and thank you very much for your time.
Thank you, Dr. Abdelrahman, for providing such a detailed information to us. Now, before we move on to the QA, we have a special guest that we'd like to introduce, Dr. George Mishah. He's a pharmacist and has sales and marketing experience with international and local companies such as Organo, Baxter International, and Aroways Medical. Dr. George Mishah has GCC market experience since early 1980s, and he's a buyer of Taiwanese products since 2005. Now he shared his extensive experience with healthcare with our colleague at TITRA. Please welcome Dr. George Mishah to share a few words with us. Are you with us, Dr. George? You can open your microphone so we can hear you.
Good afternoon, everybody. Can you hear me now?
Yes, good afternoon.
Thanks for TITRA headquarters for success of this webinar. Thanks a lot for everybody contribute to this success, exporter and manufacturer who attend and being patient for much information provided. Thanks also for my friends and the colleague Dr. Hessa and Dr. Abdelrahman, great experience in Dubai Municipality and regulatory registration affair for providing very useful detailed information about product requirement for regulation and registration purpose, which will facilitate job of Taiwanese supplier to open market at Middle East and UAE. Of course, if you have any question about the presentation of Dr. Abdelrahman and Dr. Hessa, you can contact us directly or via TITRA office in Dubai. Because I don't like to comment much, I would love to, I prefer to give a chance to my friend to focus on market need to export product to UAE. Regarding marketing update investment in GCC, I will have just a few words and we can share it together, but more detail will be sent about market update via TITRA office in Dubai to all exporter and manufacturer.
Okay, Dr. George Mishah, thank you for sharing your thoughts and thank you for helping us for today's session.
I still have some comment on, hello?
Yes, please go ahead.
Okay. The main line for market update and investment in GCC, what is the driver force for investment? We have to watch the growing population with greater need for health service, high prevalence of chronic and non-communicable disease, increasing utilization of private healthcare, leading position as health tourism hub, landmark project and information health courage, sustaining the development of healthcare sector, embracing digital revolution and innovation, a positive investment climate. This is all the driving force why we come to Middle East. If you look to the health investment need and opportunities, see, just small 2 slides or 2 sentences. If you watch our requirement in United Arab Emirates by 2025 will be more than 690 additional operation bed. This means that the operation room or outpatient visiting room require such number. If you look to acute inpatient beds by 2025, we require 683 additional beds, and so on for operation room, procurement care, emergency, and intensive care. So all this information are really useful and the driving force why to go to Middle East or GCC. There is a lot, as I said, to say, but the time is limited. So I prefer to send all this information to all exporter and manufacturer through TITRA office to have inside information about the market in GCC and the complete database about hospital statistics, population, and so on. Thank you so much, and looking forward to have again such type of meeting in the future.
Thank you very much, Dr. George Mishah, for sharing your unique perspective and insights on the driving force on the healthcare industry market. And I implore all the participants today to contact him or any of the speakers if you have any more specific or detailed question for them. I'm sure they are very happy to help. But ladies and gentlemen, let's come to the Q&A session today. And I see a lot of people leave their questions in the chat. But however, due to the limit of time, we're going to choose just two for each speaker today to answer. So the first question is to Dr. Nabeel. And the question is, which standard should be followed for medical device export to the Kingdom of Saudi Arabia?
Sorry, you are talking about the standard should be followed. Yes, CE is acceptable and FDA is acceptable, and it will give you a shortcut as well.
Okay, that's great. And the second question is for Dr. Nabeel as well. One of the viewers asked, is there an easy way for small-scale Taiwanese manufacturers to penetrate the medical product market in Saudi Arabia?
Yes, of course. But as I said, you shouldn't expect a short selling cycle. The Saudi market is open, and there are a lot of competitors coming from all over the world, and your product must be unique, must be a high quality, so it will be accepted and requested by the end users. It depends actually on the type of the product. If it is unique and it is solving the problem, yes, why not? It will be very important, very easy to penetrate, but you need to find the right local partner for you and the local agent that is active and able to reach the decision makers.
Thank you, Dr. Nabeel. That's very helpful. And now we have questions for Dr. Hessa. So Dr. Hessa, our viewer asked, is there a specific regulatory to follow for laboratory device for the United Arab Emirates to import to UAE?
Hi, everyone. Actually, the laboratory devices are not regulated by the Dubai Municipality. It's regulated by other concerned authorities in the UAE. They need to check with the concerned authority. It's not regulated with the Dubai Municipality.
Maybe Dr. Abdelrahman can answer this question.
Yes.
Dr. Abdelrahman, are you there?
Yes, I heard the question. If we are talking about laboratory items, I believe this will be falling under the general definition of medical devices and in vitro diagnostics, for which registration of medical devices or classification as direct clearance may be applicable.
Thank you, Dr. Hessa and Dr. Abdelrahman. The second question for Dr. Hessa is that, is it possible to find a local distributors through open data from the Montaji system?
Can you repeat the question, please?
Yes. Is it possible to find the local distributors through open data from Montaji system?
Actually, Montaji system will not give you the open data for the distributors, but you can find any distributor locally, and you can start, through the local distributor, you can import the product and register the product. By the way, this is worth mentioning that in Dubai Municipality, we update our regulations in regard to that not necessarily to have a license in UAE. We open to obtain the license from any licensing authorities in the UAE can be in any Emirates, as well as can be in the local mainland or free zone areas. But we cannot give you that certain distributor. Maybe you can search online, you can get some information. But Montagy doesn't offer this feature or open data for local distributors.
I believe, James, that Taitra office in Dubai is willing to sourcing buyer or distributor for all exporter and manufacturer in United Arab. And we are also here to help with that as well, me and Dr. Abdelrahman, because Dr. Hessa is working for government, then they cannot recommend any distributor or any local agent for that. As I said, Taitra office in Dubai, myself, Dr. Abdelrahman, are available to provide any information about that.
Thank you very much, Dr. George Mossad, and thank you to Dr. Hessa for answering the question as well. Then we have another two questions for Dr. Abdelrahman. And our viewer asked, can we submit company registration with several manufacturing sites at the same on the same application, or can we only register one site for each application?
Each application is for one manufacturing site only. If you have several sites involved in the manufacturing process, you have to submit a separate application for each site.
Got it. And now the second question is, what is the GMP standard for drug products? Is a PICS GMP acceptable, or site inspection for UAE Health Authority required?
Well, as per the guidelines, there is a possibility that MOH might request a site inspection, but I haven't seen it happen for over 10 years already. So I believe a GMP issued by the competent health authority in country of origin would be sufficient.
Okay, thank you very much, Dr. Abdelrahman. And I think that's the time for today, and that's all our questions. I want to thank all the participants. I want to thank all the speakers for joining us today. And ladies and gentlemen, we'll be concluding today's webinar. Thank you for joining in. We hope through today's program that you have learned about a better understanding of the UAE and the Kingdom of Saudi Arabia medical market. We wish you all a prosperities and good health. And please leave your comments with our feedback form. And thank you so much and have a great day. Bye-bye.
Bye.
Bye.